Kalydeco is a medication used to treat cystic fibrosis in individuals with an abnormal CFTR gene. It can help improve breathing, reduce the risk of lung infections, and promote weight gain. The daily dosage and optimal timing for taking Kalydeco will be determined by your healthcare provider. Before you start taking Kalydeco, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily, every 12 hours. If you are taking the tablet form, take it with fat-containing foods and swallow it whole. If you are taking the granules form, mix it with soft food or liquid and take the entire mixture within 1 hour of mixing. The dosage is based on your medical condition, age, weight, response to treatment, and other medications you may be taking. Use this medication regularly at the same time each day to get the most benefit. Avoid eating grapefruit or drinking grapefruit juice while using this medication. If your condition does not improve or worsens, make sure to inform your doctor. If you experience dizziness, headache, or nausea, it's important to let your doctor or pharmacist know. Keep in mind that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, it's essential to tell your doctor right away if you experience any serious side effects, such as vision changes. It's important to note that ivacaftor may rarely cause serious liver disease. If you notice symptoms of liver damage, such as nausea/vomiting that doesn't stop, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes or skin, seek medical help immediately. Additionally, ivacaftor can commonly cause a rash, which is usually not serious. However, if you develop any rash, it's crucial to inform your doctor right away, as it could be a sign of a severe reaction. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience anything not listed here, it's important to contact your doctor or pharmacist. There may be other side effects as well, so it's essential to discuss any concerns with your healthcare provider. Before taking Kalydeco, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems. Before using Kalydeco, also let your doctor or pharmacist know about your medical history, especially if you have liver disease. Kalydeco may cause dizziness. Avoid alcohol or marijuana, as they can increase the dizziness. Do not drive, operate machinery, or do anything that requires alertness until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use Kalydeco only when clearly needed, and discuss the risks and benefits with your doctor. This medication passes into breast milk, so consult your doctor before breastfeeding. As for the daily dosage of Kalydeco, take it exactly as prescribed by your doctor. It is usually taken with food and water, twice a day, about 12 hours apart. The best time to take Kalydeco is at the same times every day. It's important to be aware of the potential drug interactions with Kalydeco. Other medications can affect how Kalydeco works in your body, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some examples of medications that can affect the removal of Kalydeco from your body and may impact how it works include mifepristone, rifamycins, such as rifabutin, drugs for seizures, such as carbamazepine, phenytoin, and St. John's wort. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. Remember to always follow your doctor's recommendations for taking Kalydeco, including the daily dosage and optimal timing. If someone has taken too much Kalydeco and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It is important not to share Kalydeco with others. Before starting this medication, you will need to undergo various lab and medical tests, including CFTR gene testing, liver and lung function tests, and eye exams. It is crucial to attend all medical and lab appointments and consult your doctor for more information. If you forget to take a dose of Kalydeco and it's been less than 6 hours, take it as soon as you remember. If it's been more than 6 hours, just skip the missed dose and take the next one at your usual time. Don't take a double dose to make up for the missed one. It is important to store Kalydeco at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and in a place that is not accessible to children or pets. When it comes time to dispose of Kalydeco, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. And remember to discard the product and it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.